Okay, good morning, everybody. Welcome back to another episode of Black Mental Health Matters. And today we are celebrating World Mental Health Day. And this year's theme is making mental health a global priority. So, with that being said, today I'm co hosting with Sarissa Brown. I'm just going to introduce myself really quick. My co-host is going to introduce herself, and then we have the lovely Miss Sonia Hart that is our guest today, and we're going to let her introduce herself. So, again, my name is Trinity Thompson. I am a 2021 graduate of Spelman College. I majored in psychology with a concentration in mental health. And mental health for the Black community is my career passion. So I'm gonna um, uh, pass it over to Miss Sarissa.
Hi, I'm Sarissa A. Brown. I am a mental health advocate. I advocate for many stuff, a lot of things, but mental health is my passion. I also am a caseworker, so I get to fight this daily. This is really something I believe in. So now I guess we introduce our guests.
Good morning. I am Sonia Hart. I am a licensed spiritual practitioner with Centers for Spiritual Living. And I also work with persons who are experiencing mental and emotional unwellness. But my major work consists of working with soul trauma.
Okay, amazing. And how has that been? Like, tell us a little bit like how you got started into that.
I got started through studying the philosophy of Ernest Holmes, which is called Science of Mind. And that's how I got started,
Hmm.
wanting to understand more about how religion, or rather spirituality, and mental well being ties into our overall well being. And that started some 30 years ago, and I became a licensed practitioner last year after 4 years of studying.
Hmm. Yeah, I know. Definitely, like within the Black community, we tend to rely heavily on religion and spirituality to kind of get us through like our tougher mental health times. So I think that like it's really important to kind of bring like a level of professionalism to of spirituality and religion to mental health and kind of like connecting those dots and also providing like that level of professional like healthcare, like adding that kind of aspect to healthcare. So I think that's really amazing.
I think it's important also, as someone who was, this is how I got into it. I was actually diagnosed I had a mental health diagnosis. And the first thing people started coming at me with was, you don't have enough faith. You did something wrong. And I was like, no, I didn't. Like, it's something, it's with my brain. So to have someone like you who understands and, works with this in a professional way, appreciate that.
Yeah, definitely. So with today's theme, like I said, we are celebrating World Mental Health Day with the theme of making mental health and well-being a global priority. So for our viewers, if you want to explain really quick to you, how would you define what mental health and well-being is?
Let me press pause for 1 minute and give that some serious thought, because very
Okay.
often when we hear the word mental health, we start to think psychotic.
Hmm.
That person is definitely not here. Their thinking is way off. They're not connecting the way that normal people do. But
Hmm.
mental health goes beyond being psychotic. There's so many variations of not feeling well mentally. And if you look at physical well-being, there's so many other aspects of not feeling well. You can have the common cold to something as serious as a terminal illness. It is the same with mental health. It can be so subtle that it is not realized, that we don't recognize, what, something is going on, or people around you don't recognize that something is going on. They think, oh, you're just acting out. But there are so many traumas happening at an emotional level that sometimes people are not aware that they're not handling things well, because A lot of stuff gets swept under the carpet as, oh, you're just acting out, you know.
Mm-hmm.
You wake up one morning and you start to behave badly, you know, you become quarrelsome, and they say, oh, don't pay any attention to Sonia, she's just acting out. We do not look for the underlying causes of why is Sonia acting out? What has she been holding on to that is now manifesting in this way? And
Right.
very often we carry a lot. We don't talk enough about what is happening. And I think that comes from a place of embarrassment. I feel ashamed to let people know that I'm vulnerable. And I have been there for several years. Your closest friends, you don't share the emotional stress that is happening in your life because as a black woman, I wanted to appear to be stronger than I really am. So I know about bottling and storing all of that negative emotional stuff. Somebody says something to you that you know is not true, and you go home and you just nurture it some more until eventually it mushrooms out into big atomic bomb, you know, and then you have to seek help if you are so inclined.
Yes, thank you so much for that. I want to take a step backwards really quick. I want to introduce our other guest, Dr. Kay Hubbard. We are so happy to have you here. You know, this is just a beautiful platform of Black women, and I appreciate it. Really quick, Dr. Hubbard. Right now, we just introduced ourselves, and we were talking about what mental health and well being means to us. So, if you want to go ahead and give yourself a quick introduction and give us your definition, how would you define what mental health and well being is?
Yes, thank you for welcoming me to this platform. Lovely to meet all of you. Apologies for the tardiness. Um, so I'm Dr. Kay Hubbard. I'm a naturopathic doctor, as well as I have an MA in clinical psychology. Um, what mental health means to me, it means so many things. I would say that um, it's the ability to fluidly move through our emotional range. So there's an emotional health component to it. And that allows us to get so much more done when it comes to connecting with ourselves and community and the world. I'll keep it short and simple.
Definitely, I agree. As a Black woman that deals with her own mental health challenges, and also I work in a psychiatric facility, so I see a variety of mental health challenges that other people deal with on a day-to-day basis. I think definitely, Sonia, you hit the nail on the head, and also Dr. Hubbard, you also hit the nail on the head as far as there being an emotional component to it, and it could just mean so many different things. It could look like so many different things and look like so many different things on different people that there really is. It's very fluid, and that there's no like really it's hard to describe it because um there's just so many different components, and it doesn't look like this one set thing. I think that especially within the Black community, we have this stigma that surrounds mental health, like, oh, this person is being psychotic. And yes, as psychosis is one really important and one very visible component of mental health, but it's not the only thing that it's not the only disorder in the DSM-5. And I think that um, platforms like these are it's really important to educate our people on what mental health looks like other than somebody experiencing visual and audio hallucinations and things that are not a part of our reality. So I think that's really important. What about you, Sarissa?
Well, I see a lot of if a person has a bad day, and so like I think Sonia mentioned this, like the bad day just kept going on to the point they just blow up. Then people start saying, "Oh, they're bipolar. Oh,
Mhm.
don't listen to her. She's crazy. She's bipolar." Well, that's not even what bipolar is, So I, I do want our community to learn what these things really are. It's like, for they just, I want to learn what these things really are and what they really mean. She could be, but just because someone had a bad day or your child is acting out or this is going on, don't just dismiss it. Or it really could be something going on and you need to take them to be treated or tested or whatever.
Mm. All right. Yeah, I think that, we pretty much covered our experiences of mental health and well-being. So I definitely appreciate everybody's definitions and everybody's takes on it. For our viewers, as you can see, like we said, it does look like a variety of different, things, different experiences on different people. And I think that the best way to kind of go about it is, if you don't know, educating yourself definitely is the route to go, instead of ignoring it and suppressing it. Especially Black people in general, we have this kind of suppressive, maladaptive coping mechanism that we just kind of brush it off our shoulders. We sweep it under the carpet, we don't deal with it, and that is actually super harmful to our mental health, because that, even though you're sweeping the problem under the rug, it comes out in so many other ways that you wouldn't even realize is affecting you in general. So I think that yes, just pretty much educating yourself about it could be the best way to go. So my next question, or me and Source's next question, will probably be, what similarities exist amongst mental health across global populations? Like, do you think that we as a human race share similarities, like no matter where we go? Just, I don't, let me know if that question is making sense, or if you want me to reword it.
I would like you to repeat the question.
Okay. So, my question is, what similarities exist amongst mental health across global populations? So, do you think that regardless of our cultures, regardless of our demographics, where we live, our age, do you think that there are similarities that we all share, just as people, regarding our mental health, like regarding like the way we feel, the way we interact with others, how we deal with our emotions? Because this is World Mental Health Day, so I want to talk about people as a whole, globally, worldwide.
Oh, that's a loaded question.
Yeah, but I would say yes. If you understand the human construct, that there are similarities regardless of where you are on the globe. We are emotional, we are spiritual, we are physical beings. And what affects one person affects all people. Let's say, for argument's sake, if you walk into a room and there is that negative energy, there's something negative happening, it impacts you, the person who just came in from outside. It is difficult to say that we don't share in the same mental atmosphere, because we all do. And I'm going to bring this from my understanding of spirituality, where we believe that there's one source of power for everything, and that we're all operating within that one source. And therefore, if we're all operating within that one source and came from that one source, we're all going to feel the same way about things. And that's in a generic form, yes, because at an individual level, things will not impact each and every one of us the same way. Let's say, for argument's sake, your boyfriend got up this morning, or your husband, and say, "Look, I'm out of here." Some people will throw a party, and another person is going to pray all day long. But at the core of things, we all have the same construct. We're all made of the same substance. And in mental health affects everyone across the globe. In varying degrees, yes, but it affects everyone.
Mm-hmm.
And that's my opinion. That's my opinion.
What about you, Dr. Hubbard?
Yeah, I would have to agree with that. I mean, mental health, all of our forms of health. So, as a naturopathic doctor, I deal with physical and mental. Um, and everyone's body and everyone's mind is seeking health or wellness in some capacity. So, yes, there are similarities. But I mean, I'll just say this since we are on Black Mental Health Matters. um, I find it interesting that what many of us have been taught to traditionally practice mental health is from a very Eurocentric standard and set of ways, which would cover what? Canada, America, most of Europe. And then the majority of the world has been colonized. And then, so I think that there's actually a difference in the way that we can practice and support people's mental health in those ways, because those are huge differences in the way populations operate. Just like every country is going to be different, every culture is a little bit different as subsets of that. But one of the bigger subsets is, does everyone look at you as an immigrant to somewhere? Or are you automatically able to take up space, which can also create a set of challenges in its own way, but we're not here to talk about that. So so yes, there are similarities, and one of them is the way that our groups of people have been treated over time.
Yeah, I definitely agree. And I'm glad that you mentioned that, because when I was at Spelman, I took a psychology of the African American experience course. And we learned about, with Spelman being an HBCU, and with this being a mainly Black race centered class or course, that often we learn from a Eurocentric perspective. And it wasn't until that I got to that class that I actually learned about psychology and mental health from a Black perspective, written by Black doctors, in that, as time goes on, we're going to need to not completely shy away from the concepts and things that, like, we have learned all together, but there are certain aspects of mental health that do pertain to certain cultures. So there, we can group the human race like together, just as one people. But the reality is that we do have different experiences as it pertains to mental health. With Black people having their own set of experiences, and then even then within our Black community, because Black is just a race, we have so many different ethnicities and cultures, and we're spread out across the diaspora, where we all have different experiences of mental health and the things that have impacted us and the things that we all go through. So to kind of counter our own question, there are similarities, but there are also differences, because we do not all share the same living experience. So,
I agree. I agree that we all have similarities when it comes to mental health. Anybody can have a mental health issue. But I don't know if any of you have been there yet or heard of it, but the EGI Museum in Montgomery. I just visited there. So we watched from the transatlantic slave trade all the way to how it ends up in prison today. And so it got me thinking yesterday about that trauma is still in Black Americans, Ghanaian slaves, all these people that were enslaved. No one can experience that trauma like we can. It's like we didn't go through it. I know people say, "Oh, your ancestors went through it," but we're still, we still have things that we deal with that comes from that to this day, and I think it messes with our mental health. So, thinking about that and thinking about the Black dysphoria, I, and I can't speak for other races, but thinking about that, I don't think that we all experience it the same, because it's something in us that's different.
right. Definitely. Even within, like, the African American community, I have a really close friend, and she is a first generation African American. Her parents are from Ghana. So my experiences couldn't be completely different from hers, because my family has been here in the States since probably the 1800s, whenever it was that we were brought over here. But yes, it's just there's so many different layers, and it's just it all goes back to intersectionality, that we can still continue to categorize. There's going to be many categories that we can group ourselves into that make our own experiences different from the next person. So moving along, I wanted to ask, what, if any, social determinants do you think influence mental health?
Okay, I'll go. Okay, social determinants, one of my favorite topics. I'll start with one we don't always think about, which is work and access to purpose behind how you spend your days. Because people generally have to work to survive, or to survive at the level that they're intending to, I'll put it that way. But when you're underemployed, or when you don't have access to the type of things that feel creative or fulfilling, can really put a damper on mental health, and that's across the diaspora. And even if you're choosing to be stay at home, or all of those things, mothering I consider to be very meaningful work, fathering as well. So, but if any of that is messed with on a systemic level, I think it can really mess with people's mental health.
I agree with you there. I agree with you. I think that that is important, and that's why persons should be encouraged to not look at just a job as a means of survival, but finding fulfillment within the job. I think that that's important, because if you're just going to get up every morning, get dressed, and go to someone's environment to work, and you're not happy there, you're just doing it because I need money in order to pay bills and keep the roof over my head, and you're not feeling fulfilled, that in itself creates a lot of stress, trauma. Um, and I think that's the greatest um, form of mental health illness within most Black communities, where persons are not encouraged to find work that is purposeful and creative for them, the thing that you feel passionate about. I know, for example, here in Barbados, we're encouraged from a young age to strive towards financial affluence as a form of, or let's just say a form as a show of wealth and accomplishment. But as I got older, I realized that that is not necessarily the best approach to life. That the best approach to life is going within and asking the God of your understanding, what is my purpose for being here? Why am I here? What am I supposed to do? And I say this because for myself, I know my parents and teachers guided me along a certain path, and I failed to accomplish in those areas. It took me many years to come to the place where I recognize I am here to serve humanity. I'm here to be that bridge that help people to rediscover their wholeness. I'm not here just to have financial wealth. I mean, financial wealth would be great. I would love to be financially, affluent, to have all the money that I need to just go shopping, do whatever I want when I want. But I find the greatest joy comes to me when I am out serving others, helping to feed people at the church, doing things for humanity at large. That's when I find the greatest joy. So if we can get people to come to that place where rather than work towards having employment where you have a lot of money to pay bills, you're looking at how am I going to satisfy my soul's purpose. I think that is important. Satisfaction of one's soul purpose. What is it my soul longs to do in human form?
Yeah, I would say, even looking at that from a larger perspective, being like just the socioeconomics of people's mental health state, that could really put like a damper. I see with my patients a lot at the hospital that there are a lot of people that are homeless, and when they don't have anywhere to go, and it's like the only thing that they know to do to kind of keep themselves like afloat is to get admitted to hospital, which they do have underlying mental health diagnoses and disorders that should be attended to. But the reality of the situation is that a lot of people aren't happy because they cannot sustain their lives the way that they would want. So like you said, finding your soul purpose and finding that through a career is super important to our mental health, because I think that I would be shattered if I did not have a job and I did not know where I was going in life. Not to say that people that don't have one, no, I don't want to get that misconstrued, but not to say that people that don't have a job are unhappy, but a lot of us do rely on financial dependent, like are financially dependent on having a career. So even like where you live, like the environment that you live, whether you live in a dangerous neighborhood and you want to make it out, but you don't have the money to make it out, or whether you live in the house on the hill, even that still doesn't really like it's still a little irrelevant to mental health because you still could be unhappy. But the reality of the situation is that people would be a little less stressed if they were financially stable. So I think that like your demographics, like where you come from, your access to resources, your just overall environment in the community, whether like you feel safe or whether you have the money to be able to make ends meet, that definitely does, that can put a level of stress on a person's mental well-being.
I agree with all that. Um, One that I think about also is your people. Not it doesn't have to be your family, but like your friends, or who do you have to support you? Like when you're going through things, or who can give you resources. I think those things are also they're just as important. All those things you all named, yes, they are important. That's how the world works. But also it's great to have a network of people that's there for you.
Right, definitely. Because you can't do it alone. Yeah, if you're isolated, that is not gonna do anything for you.
Yeah, I agree wholeheartedly that so much could be averted, like so much depression and anxiety, if there's someone that you trust who cares about you and has your best interest in mind to talk things out with. I think a lot of my work as a mental health practitioner, in some ways, I get paid to be people's confidant or friend or to talk things out with. And we live in a society that needs that because there's not enough people who have communities who support that naturally.
Mhm.
Um, I imagine in some indigenous populations, there's less of a need for a formalized version of us. Maybe, not sure. um, but I do think that a strong like society that is that has the tenets and values of being supportive to who people are and what they may be going through is really important.
Definitely. Well, speaking of like populations and communities and things of the sort, I would want to know, and I think maybe this might be the same kind of question, but just like looking at it in from like a healthcare perspective, what kinds, because you both are mental health professionals, so what kinds of disparities do you see exist within like your perspective fields when it comes to mental health services? Like whether it be
I would,
the types of like populations that you see like that can like maybe afford or not afford, or like your access to them because they maybe they're too far, or yeah, just explain a little bit about that.
I would say that definitely disparities. I remember when I was taking a course in clinical pastoral education, having to be assigned at the mental health hospital here in Barbados, how it was the most depressing thing for me because of the condition of the hospital. I would think that if you're going to have people institutionalized, that the environment and would be beautiful and appealing, but that was not the case. Granted, the place is nice and clean, but there were some areas that just, for me, and I didn't understand why some people were housing little cells. That for me is, you have a mental health issue. Do you need to be locked away like that? There were things that I didn't like, because I know that for those who can afford to go to see a psychologist privately or psychiatrist, it's a different environment. They're kept in their home environments, with nurses and the help that they need. But if you have to go to the public psychiatric hospital, then it is a little different. And one of the things I discovered too is that not enough funding goes towards mental health here in Barbados. I can speak for Barbados because I did my research. You have 10% of what is allocated for health going towards mental health, and there's not enough funding. There's only one mental health hospital, and up until recently, that mental health hospital housed both adults and children. Up until recently. So there's not enough funding for these things. And if you're coming from the lower socio financial bracket, then who can afford to pay a psychologist $150 when that's what you're making a week? So it comes down to, yes, something is not right with me, but can I afford to pay for that? If I'm seeing coming out of the mental hospital, that's going to be one big stigma, and that's not what I want for myself. Especially when you live on a small island where you're like in a little fishing bowl, everybody knows everybody, and everybody's in everybody's business. So these are some of the challenges that we have in terms of finances to get into proper mental health care, at least from where I sit. There's a lot more that can happen. I think there should have been smaller clinics outside of the main one. Less that would help people at a community level, have community clinics where people can come, sit down, and talk to someone about what they're going through, their challenges, and not just adults, but a safe place for younger people to come and speak about what's going on. But it comes down to financing.
Yeah, I definitely think that financial status, your economic status is definitely, I would say, in my opinion, is like the biggest determinant as far as like people seeking mental health services. I know from personal experiences, although I am blessed to be able to seek the help that I need, there were times where it was costly for me to have to Uber back and forth because I was in college, going just starting to see a therapist, and seeing also a psychiatrist, and I did not have a car, but those costs definitely did add up for my parents and I having to Uber back and forth to my doctor's appointments and co-pays, because the insurance also plays a huge role in that financial burden, having to pay co-pays and pay for prescriptions and pay for services. And at one point, I definitely was just like, what, this is getting expensive. I really don't know if I can keep up with this. And I did feel a little discouraged to continue because it was a financial burden on me and my parents. So I could imagine now working in a psychiatric hospital, seeing a portion of my patients that don't know, or they're here at the hospital, they don't know how they're going to pay for it because they don't have the insurance. People that want to get the help, just in general, people that want to get the help, but they don't have these types of resources within their own community, or at least quality health mental health care, because some people it's not the type of help that they need or that would most benefit them. You know, some people might benefit from cognitive behavioral therapy, and there are no cognitive behavioral therapists that can really do an adequate job of, you know, doing or just attending to specific needs of the patients that exist in that community. So I think that, yeah, pretty much that. I think that would be like the one of the biggest disparities that people, especially people in colored communities, face, because there aren't that many uh, services and resources that they can access that also come at a low cost and aren't a financial burden to them.
Well, something that I think of listening to this conversation kind of goes back to what we were talking about with, you know, the money and jobs and all that. People that have gotten really sick and they need to go for inpatient, but they're afraid of losing their jobs because they're not going to have that paycheck and they got
Mm-hmm.
to take care of home. So they get sicker because they don't have the care that they need, the correct care. So this just made me think about that.
Yeah. No, I've had countless conversations with people that are just like, but you don't understand, like my job, I'm gonna lose my job. People that are depending on social security income and they're afraid that they're gonna lose that. It definitely it's kind of defeat like it plays a part in defeating the purpose of why they're there because they're so worried about getting out when in reality that's a place that they need to be in. But not everybody can afford to spend days on end in a hospital when they have people at home that are relying on this one sole paycheck. So I think that that definitely is something that we could bring more attention to. But we're gonna get to mental health worldwide. So I want to switch the conversation over because it is no secret that we have faced probably within our lifetimes the first pandemic with COVID-19, and it has had so many different effects on global populations, such as um, financial, people losing jobs or people not being able to work because of quarantining. It's had physical effects. You know, we've lost many people. Many people that have gotten sick and have not recovered, you know, 100%. Many people that have recovered, it's done very drastic damage on it's shifted the way our population exists, sorry. And I think you could go anywhere in the world and ask anybody and they can tell you about how COVID-19 has impacted them because it hit all of us. Nobody was, you know, exempt from COVID-19 and any other effects that it has had on our population. So my question to you, Dr. Hubbard and Sonia, would be: how do you think the pandemic has affected our perception of the importance of mental health?
Oh. um, I think it's definitely, as you said, it has hit everyone in a completely different way, and regardless of where you are socioeconomically. I've had conversations with people who were very wealthy, who maintained their wealth throughout the process, but were terrified because they were responsible for so many other people. Like if they owned a chain of restaurants and then the restaurants are closed for 8 months, how do they keep people employed and like all of those sorts of things. So you're right, it hit everyone in different ways. Um, so I guess how did it affect mental health was the question, like globally?
Like
Impact?
people's perception of mental health, like after or since the pandemic, do you think that people are starting to take it more seriously? People are taking it less seriously?
Yes, I think that people who well, for a lot of us, it forced us to be inside. There were essential workers, which we figured out who was essential pretty quickly, and then didn't pay them, and that's another whole thing. But um, uh, I would say that the way that it has impacted the mental health industry is that it's more talked about. I can speak for, I mean, I live in Los Angeles, which is one of the wellness capitals. So we talk about everything, and people will pay a lot of money for it if they think it's new and cool, and will like eradicate all of their trauma because they want to escape certain things.
Mm.
Um, but I mean, I saw Taraji P. Henson was launching her foundation around the same time. And there were more and more people, like our access to people through social media was different because that's all the access we had. And so people started showing up in different vulnerable ways. Um, I, I don't know why this one's coming to mind, but I remember seeing Sterling K. Brown. He plays, anyway, he's on a show where he plays a guy that's a runner. That's the important piece of this story. And he was going for a run, and he remembered Ahmaud Arbery. And he just like broke down during his run and started crying, and he went live, and we all had access to that.
Mm.
Um, and so it wasn't just COVID, it was also the uprisings, I think, had a huge effect
Yes, we
on
definitely, yeah. Amongst COVID, we also had a lot of different social justice things happening.
it.
It,
Right.
yeah.
Yeah, we had that. And then here we also had who was our president at the time doing
Mm.
whatever he was doing. So I think all of that laid on top of everything. Everybody was like, it's kind of okay if you're not okay. Like that's starting to make a lot of sense right now.
Yeah.
Um, so I could keep going, but I'll stop there. I'll leave a little space.
I would like to say that on that topic, we're social beings. And I think one of the greatest impacts on our mental well being was having the freedom to socialize taken away from us. It is my opinion, I don't have statistics on this, that a lot of people suffered from depression as a result of not being able to touch, that hugging and being in close proximity to each other, not being able to visit your relatives. Um, I think it impacted people in a really big way, in that our freedoms, the things we took for granted, have someone saying, you can't do this because. I know for me, the hardest part of COVID-19 was accepting that this is something that can kill you. My views on death are very different. So for me, when someone says, if you don't do this, you will die, and my pushback was always, I will die regardless. I want to be free. I want to go where I want to go, when I want to go. I want to live life. I want to have it and have it abundantly. Just do the things I'm so accustomed to doing without all of these restrictions. And I remember reading this book by, I can remember her first name. She's Dr. Melissa. And it's called Mind Over Matter. She's a medical doctor. And in that book, she spoke about a society of immigrants to the USA who didn't suffer from illnesses, physical illnesses, because they had that community where, the evening you come home from work and we're just getting together and having a good time. And the idea is that socializing, having great social relationships, plays a significant impact on our well being. And as someone who grew up in the Caribbean, I remember my days under the tamarind tree where you had several generations of people congregating. And those were happy times. But as we have shifted our lifestyles to be more, I would use the word productive, where everybody's going out to work, especially the females in the family, you no longer have that social gathering happening. And I can remember one of my older cousins, and she's like 20, 25 years older. These two of them playing marbles with us, hopscotch and Chinese skipping with us, and road tennis with us as a young girl. And this form of socializing brings wellness overall. So when you take that away from the people, when you say to people, you can't socialize because I'm afraid if you socialize, you're going to spread illness, that impacted on a lot of people. I know here in Barbados, for me, it was hard. It was challenging because I felt as though my freedoms were taken away and that there was nothing I could do about it single handedly.
Mhm.
So basically, what I want to say is that for most people, mental health is linked to that personal freedom of your person, having that freedom to do with your person what you want to do. So imagine taking that away at a mass level and saying, no, you got to stay indoors for 2 weeks or 3 weeks and you're shut down, you can't go out, you can't do anything. And then there's also the fear here in Barbados where there were some heavy fines if you were caught on the road after a certain hour with the curfews. So imagine you having all of that to deal with. And it is not as though it's something that came gradually. It was a sudden movement. 1 week you're shopping, next week it's like you can't go out your house. So of course COVID had a significant impact on people's mental health. And I don't think people have recovered from COVID as yet in terms of their mental and emotional stability. Sometimes it's almost like I am waiting for the next shoe to drop situation. What is going to come down the pipeline next? So we have, I would say, a level of anxiety happening that no one is talking about. And with that, I'm complete on that subject, on that line.
Yeah, no, definitely. With the anxiety, I think like touching on the anxiety is like and the feeling of uncertainty of when is the next shoe gonna drop, like you said. Well, when is this gonna be over? We don't know when a worldwide virus is going to just die down. I mean, luckily we are at a much lower percentage of people with COVID, even though it's still happening, and we are not in this like state of mass hysteria, which I also think has made the mental health of everything a lot worse. Is people looking for others to blame. Like, well, they started it. Like the COVID came from this place. COVID came from that place. People keep spreading it. There's the people that want to stop or decrease the number of cases that exist by doing what we're supposed to do, which is wearing masks, hand sanitizer, all that, versus the people that want to exercise their freedoms and not want to contribute to making our shared environment a healthier place. I also think that with COVID, just we've never experienced a period in our like within our lifetime where we've had our freedoms taken away, where we can't socialize, and I think that that definitely put a damper on a lot of people. I know, like a lot of the reality shows that I watch, when they were, coming into like the COVID era, everybody's at home and everybody's just like I feel like I'm going stir crazy in this house. And I think Dr. Hubbard, you touched on this, like the only way that we were able to communicate with each other and like be vulnerable and share our human emotions about COVID was through social media. So you saw a lot of celebrities kind of coming to the forefront and being like, oh, like, besides COVID, like mental health is actually serious. And I feel like it kind of sucks that it had to take a real pandemic to realize the severity of mental health. But at the same time, not everybody is thinking of that until we are forced to be in a situation where our backs are against the wall, and this is ultimately our new reality: is having to stay indoors for a period of time, having to not be able to freely travel and go wherever we want, whenever we want. Even jobs were affected by it because we saw, like you guys said earlier, we saw who were essential workers versus who weren't, and that definitely affected like our economies all over the world, not just the economies here in the States or any country around the world. It affected everybody's economy. um Sarissa, what do you think?
I think you hit on what I was just about to say, Trinity. Nothing good was about COVID. I want to stress that COVID was not a good thing. But I did like that all of a sudden more people started understanding and caring about mental health. And the online therapists and psychiatrists and their businesses, those like I forgot the numbers, but it skyrocketed. People started seeking help and saying, "Yeah, I do have a problem." Um, Also, I like that jobs started finding things that they claimed they couldn't do, like working from home. And now the effects of that, like I enjoy working from home. There's other people that enjoy that, so it's like the freedom, like just some things. All of it wasn't terrible. It was some, the mental health, the freedom of working from home. There's probably other things that happened during that time, but I do like that some things were changed and it opened a conversation, a dialogue for mental health.
Yeah, I definitely think that not that it completely changed our societies, but like it showed, and like it didn't. It's not that it did good, but it showed us a new perspective of how our societies can function. You know, like working from home and teaching the kids from home, like different. I don't want to say the word opportunities. It's just like a different angle of how we can function without being with each other face to face in the event that something like this were to come up in the future. And I think that going back to the whole mass hysteria thing, that when the next shoe is gonna drop, we also had the scares with the different variants of COVID. You know, this is coming. Oh, this is more dangerous than the last. Everybody has to get vaccinated right now. Then we had monkeypox, and everybody was like, "Oh my god, like we're gonna get shut down again." And so I think that a lot of it definitely I'm grateful, or I'm a little more appreciative of the fact that this has shown people, that mental health does get serious, and you could think that you're perfectly fine. You know, you're your average Joe going to work every day. You got kids, good, and you have the freedom to go out into public and do whatever it is that you need to do to live and maintain a healthy life and a happy life. But now we see that when, like I said, when your back is against the wall and you have to be at home, it's showing us a new perspective of how our society can function without being face to face. So I definitely want to move a little bit forward because we don't have much time left. So we're going to talk about just mental health from like a global perspective. Worldwide, doesn't matter if you are from the diaspora, outside of the diaspora. We appreciate everybody. You know, it's not just about Black mental health. We care about everybody's mental health. So I want to know, or me and Sarissa, we would like to know what's from you guys' professional perspectives. How are you promoting mental health and well-being within your businesses? Like, how are you promoting? Yeah, how are you promoting? How is your business promoting good mental health and well-being in your communities?
Well, as a licensed spiritual practitioner, what I do is offer spiritual support and guidance. One of the things that I encourage people to do is to change their thinking, to change their life. And I'm going to say that because I'm coming from a metaphysical and quantum physical position, I'm a firm believer that we can change any circumstances based on what we start to believe about it. If I remember correctly, Einstein said that imagination is greater than knowledge. I might have left off a word or two. And this is how I work with clients, by getting them to change their perspective about things that are happening in their life. So if you're coming to me and you're saying, look, I'm broke today, I have no money, we change your perspective through counseling as well as doing affirmative prayer. As I said, I'm into metaphysics and quantum physics. So by using our words, we change our thinking. We take the specific actions that are necessary to help bring about change. And it's all about giving that person the spiritual support and guidance, helping them to find out the root cause of the problem. There's no camouflaging and say, okay, go home, take 2 Panadol, your headache will go away. Let's find out What's causing the headache? So if there's trauma happening, let's find out what's causing the trauma. And some trauma comes from, I'm going to say the word restart, what we've been conditioned to believe as a people from generation after generation after generation, the things that we've been conditioned to think of, things that sit in our subconscious minds. And that's what I work with, helping you to find that and change it. I'm complete. There are no more words.
Dr. Hubbard?
Oh, it's on me. Okay. Um, what do I do? It feels like such a big question because it sounds like such a responsibility. Um, at least that's the space I'm holding right now. Um, so what I do right now when it comes to virtual practice is I work with a collective called Soul Care. Um, they only serve BIPOC populations across the globe. But it's really nice to be able to have that access because here in the U.S. everything is very perhaps as it should be. So I'm not complaining, but there's very strict licenses that allow you to practice within a certain state. But as a mental wellness practitioner, I'm able to have a much broader reach across the diaspora, which is really nice. Um, and it's impressive because there's such a shortage of Black and Indigenous practitioners in the States. So, when I was in school and in training, I was always in demand because it was like, well, I need a Black female counselor. Like every Black woman comes in wanting that. This is also one of the disparity things that I should have mentioned earlier. But there's just not enough people who understand the experience where you don't have to educate them before receiving mental health care, or you don't have to deal with certain microaggressions while you're receiving that care. Um, so I'm happy that I get to provide that service to people on sort of a sliding scale. It isn't, I'll say it's cheaper than private practice here, but it's not necessarily cheap everywhere. Um, I think that's one of my answers to my questions. What I actually do is very similar to traditional styles of therapy Western eyes. To a certain extent, it's talk therapy. Um, CBT, ACT, like all the acronyms, we could get into it. But what I also do that I think is a nice component is because I'm a naturopathic doctor, like you just said, we treat the root cause. So sometimes, a lot of times in chronic illness, in autoimmune conditions, in women's health, there's these other pictures of mental health going on and they go back and forth. It's kind of like chicken or the egg. Which came first? Do you have medical trauma from your doctor or surgery or your dentist? Do you have issues where you just don't want to go to the doctor, which is another whole thing about our community? um, but also what is going on in your physical body that could be a manifestation of a trauma you've experienced or an intergenerational idea that you picked up or a result of disparities that you have to fight against in this world, and it's showing up as like a physical ailment as well as a mental picture. I work on things like that.
Okay. What about you, Sarissa?
Wasn't expecting you to call on me. Dr. Hubbard, that's interesting you said that though. When I was at that museum I mentioned earlier, I have autoimmune issues. I walked in fine. And then when I started getting angry, seeing the stuff, I had a flare. At the end, towards the end, I had a flare. So that's interesting you guys said that. I never thought about that. But like I mentioned before, what I do for a living is I'm a case manager. I work with birthing women to help them get care that they need and things for their children. But my babies and my passion to the side is mental health and housing. And I kind of see them together. It's like I love people experiencing homelessness and I love mental health care. And so I'm considered an activist, a community organizer. So you'll see me on a microphone one day, or you'll see me on my bullhorn another day. But I use my voice. Basically, I use my voice until people get tired of it. And I did actually at one point run for mayor based off something my city did that I was not happy with dealing with mental health, the way the police handled it, someone with a mental issue. So basically, I guess I'm a mouthpiece. That's what I am. You, Trinity?
So I once again I work as a psychiatric technician at a hospital that's a part of like one of the biggest healthcare systems in my state. I live in Connecticut, and pretty much we get all the kinds of patients. You know, we can get what they consider VIP patients that like are, you know, important. They have a bit of a status. We get homeless people. We get people that are currently dealing with substance abuse issues, alcohol, depression, anxiety, psychosis, all kinds of schizophrenia disorders, bipolar disorders, mood affective disorders, anything. You name it, like I have probably seen it. And the way that I feel like my job, or even just the hospital that I work for in general, kind of contributes to promoting mental health well-being is that we don't turn down patients. You know, even if like insurance is an issue, you know, the money's an issue, jobs and stuff like that, our main focus is to get the help first, because you cannot get the help if you are continuously suicidal and you're acting on suicidal behaviors, or you actually complete suicide. You know, people that actually um they want to put in the work, but they just don't know how. We come together as a system and we help them. That's our main priority first and always. And for me personally, I just love to sit down and talk to some of the patients. If I see them, you know, sitting by themselves or having a hard time, like I definitely love to go the extra mile of just sitting down and talking to them. You know, like what's going on, like what brought you here. Not really what brought you here, but it's just whatever you feel comfortable sharing. And then usually like they tell me kind of like their whole life story. I am actually very interested in I'm working on getting back or getting going to grad school so I can be a LMSW, and I want to be a talk therapist as well. You know, eventually down the line, probably a PhD. But I'm really interested in talk therapy and just sitting down and talking to people and hearing their experiences and validating their experiences as a human, as a Black woman, as a Black person. It could be as a Black man, just understanding and connecting to people from all different types of backgrounds. And I feel like this job is definitely helping me increase my cultural competency and awareness, because even though I may personally not be able to relate to every single population, there's just impossible. I can't do that because I'm not a member of every single type of person or every single type of population. I just like to sit down and be able to appreciate and have a certain level of empathy to really just sit down and understand where a person is coming from, and helping a person be able to get back on their right tracks, and just making them feel like a human again, and making them feel like a person, and like kind of bringing that. And I really enjoy seeing that person like kind of come back to life, whether they're coming out of like a psychotic state, whether they're, you know, having a brighter affect from like depression, you know, they're finally just experiencing brighter days. I think that like it's really rewarding, and I feel like this is my passion. This is what I want to do for the rest of my life. So we're running a little bit low on time. I see everybody in the comments. Thank you so much for tuning in. We've been sharing some of the comments on the screen. But to close out, what are some resources that you guys would share for people that live near you, people that live afar, people that you can help abroad? You know, what are some resources that you like to that you would like to share that can that you'd like to share with others?
I can go. um, the new 988 number, you can call or text it. if you need to talk to anyone or feel that you might be suicidal, that's good. NAMI is the National Alliance on Mental Illness. They've been around a while and they have great resources. And I think it's pronounced SAMHSA. I don't know. I know them though. Substance Abuse and Mental Health Service Administration, and those I know like have tried and true have been here.
Mhm, definitely. I would add on to that by saying Psychology Today is an amazing platform. I found my therapist off of Psychology Today, and if you're unfamiliar with the, I'm gonna create a banner so you guys can see Psychology Today.com. But psychologytoday.com is a site where you can find therapists, psychiatrists. They have a feature where you can filter through, like, if you have insurance or if you don't have insurance, you can filter through all different types of insurances and providers within your region. You could filter through zip codes, so like providers that are near you, providers that have the same ethnicity if you care about what your provider looks like, beliefs, the things that they practice, if they're LGBTQIA plus friendly, if they are religious. So Sonia, if somebody was looking for somebody that can help practice like from a spiritual standpoint, that they you could definitely find that on Psychology Today. I think that I don't know. I personally just really like that site, and I would also say if you are experiencing a crisis, a mental health crisis, if you're not feeling like yourself and you fear that you could put yourself or others in danger, definitely visit your local urgent care, your local emergency room for an evaluation, and from there, um, depending on where you live, I can't speak for everywhere, but I know that with the hospital that I work at, patients, a lot of our patients come from either the emergency room across the street from the main hospital, or they come from different hospitals all over my state, and they can come right to the psychiatric facility that I work at. So definitely don't be afraid to just walk in and don't walk out. Just don't give up on yourself.
Okay. I mentioned this resource a little bit earlier, and I think that you two have beautifully covered some of the more emergent and national resources. Um, oh, and then there's also like all of the anonymous groups. So if you're in Alcoholics Anonymous or Narcotics, or there's even Emotional Anonymous or Overeaters Anonymous, marijuana, like there's so many. There's one for couples as well. Um, But soulcarecollective.org is another resource because there's at least, I'd say there's like a dozen practitioners on there who all have different styles. I think there's one Black man and everyone else is a woman of BIPOC woman or femme identifying, I'll say. And so you can potentially find someone on there that you'd align with. And it's a global resource that way. There's also always books. Um, and I think that I'll put it this way. If there's something that you have an interest in, and if you have access to watching this, you probably have access to internet. Um, Reaching out to probably any of us because we know who else there is who's doing something. So I think that the best resources are practitioners. And if you can find one, maybe their schedule is full, or maybe they don't have access to cover you in your state or in your country or whatever. But I know that we can help find the resources once you track us down and ask.
Yeah. I definitely think like the first step is always the scariest, just not know. It's like such a massive field, and you might not know where to start, but it's just a matter of like talking to somebody. It could be as simple as, like I said, taking yourself to the nearest urgent care, and then from there the doctors can help you do the rest so you don't ever have to feel alone. It might seem scary, it might seem like, I don't want to do this, and it is true. A lot of people don't find like their perfect fit for a practitioner the first time. You know, it does take some time, or it could, I should say, it could take some time to find somebody that really understands you. Really, you think that would be most beneficial to your own mental health and well being. But like I said, don't give up on yourself. You're worth the fight. You can always use one of the anonymous hotlines, one of the anonymous groups if you don't want to feel judged. You can use any of the sites that we provided, and we'll probably put that in the description box below for this video, the different resources that we talked about. So does anybody want to give some takeaways?
Well, I just want to say that the resource for me that I would recommend is Centers for Spiritual Living. We're in 30 countries, Nigeria and Kenya in Africa, in Europe, and Barbados, USA, France, Ukraine. We're everywhere. We have practitioners, spiritual practitioners that can assist. And that's it for me.
Okay, thank you. Anybody else?
You said takeaways?
Yeah, any takeaways, anything you want to leave the people with?
Well, I'll say what my takeaway is. I don't want to give people the pressure of having something from me. I think my takeaway is that even though there's tremendous differences in there's lots of differences in the daily experience of people everywhere in this world, but through this conversation, I think we've realized how similar a lot of our mental health challenges may be, because the brain and the mind only has certain coping strategies, you know? So wherever you are and whatever you're doing and wherever I am, whatever I'm doing, there's probably someone with a similar experience. So my takeaway is that I'm not alone.
I think my takeaway would probably be, as I just mentioned, don't ever feel scared to reach out. The first step is always going to be the scariest, but it does get easier. And I think that'd be it.
Okay. And my takeaway is we were talking about being lonely during COVID and all that stuff. If you've started mental health care, keep it up. If you need it, seek it. And be selfish about it. Put yourself first, because you can't take care of other people till you take care of yourself. And if it's messing with your mental health, it's going to cause mental illness eventually. So take care of your mental health.
And my takeaway is, as Sharisa says, practice self-love, practice taking care of you first. Always go to that place of self-care. Don't be afraid to ask for help. Never be afraid to ask for help. Just be vulnerable. Be authentic.
Definitely.
That's
All right.
a good note to end on.
I want to thank everybody for tuning in, everybody that participated in the comments, anybody that had anything. I want to thank both of our guests, Dr. Hubbard and Sonia. Thank you so much for giving us your time today to talk about and celebrate World Mental Health Day. Bring some awareness to mental health, because we're all in different locations. So as you can see, this is national, international. This is a conversation that everybody wants to tune in or should be tuning into. So I'm going to go ahead and end this right here. So I want to thank you guys. I want to thank everybody that watched, and we will see you next time.